sports in the country? Well, you know, we can see we have opened up in certain sectors of the economy. Sports contributes to our economy. It also contributes to the well-being of our people. And clearly, we must do what we can to try to get our sports system working again. In many parts of the world, sports activities have opened up. And it depends on the nature of sport that we're talking about. I see no problem with those individuals, no contact type of sports. And I think that is happening in many places. Ours is largely an area where we excel in the area of athletics. Athletics are individual sports, mostly non-contact. We would like to see a situation where our athletes can go out there and compete and bring fame and glory to our country. And I think we will work on that to see that that happens. As for sports that draw gatherings and public gatherings and contact sports, I think those considerations of whether it's possible to allow those sports to continue without endangering those that the fans that go and watch these sports needs to be considered very carefully along the lines of the procedures and protocols that we have put in place. KTN, you also talked about Huduma, you talked about healthcare workers being affected in Mama Lucy Hospital. I think I have addressed the issue of us seeing that we will find infections springing up in many different places. So I will not dwell on that anymore. Nancy Okwaro, you asked about Pumwani, what is happening in Pumwani, and what actions are we taking as government. You also wanted to know how do we deal with those who have recovered from the virus, and what kind of advice do we provide them as they recover and leave the hospital. Dr. Ahmad, since he was there yesterday, I think we'll talk a little bit about what's happening in Pumwani and the actions that we have taken. But with regard to those who recover, we do what is required according to protocol, and that is recoveries are based on release from hospital once we have established that those individuals have fully recovered. In terms of if they had any clinical symptoms, that those clinical symptoms and conditions have resolved themselves, but really that they no longer have the virus in their system. So we have to test them to ensure that they are virus-free by the time they are being released out of a health facility. And that ensures, therefore, the issue of them being able to transmit the virus does not arise because they are only released once they are free of the virus. The advice that they are given that this is a new disease that has, I think in recent days we have seen that we are beginning to get much more information on the pathophysiology of the disease, how it affects different parts of the body, the long-term effects of the disease on certain functions of the body. I think we are incorporating all that, taking it up, and we are ensuring that these people whom we release, we give them the right advice, we ask them what to watch out for, and we give them the necessary advice in terms of how to keep themselves healthy, how to keep themselves virus-free, and how not to be in a position where, you know, in the event that so that they get reinfected. We don't even know whether people who have, with any certainty, and I know that question was asked, we do not know with any certainty whether people who have recovered from coronavirus get reinfected again. There may have been some cases here and there reported, but it cannot be said with certainty, and there isn't enough evidence base to be able to tell whether people who actually recover from the virus stand a chance of being reinfected. This is an area of intense research because it is important to know. It's important to know the immune response mounted by individuals against the virus and how long that protection lasts. These are important things to understand the epidemiology of the virus Because once you understand that, then you can develop strategies on how to stop transmission. So that is an evolving area of knowledge, and we look forward as this knowledge base increases to come up with some indication on how to deal with the virus. Projections, the last person to ask a question wanted to know projections of infections in the coming days, the increased number of cases in state agencies, I think I have addressed that, and whether NHIF can cover the costs for testing, especially for restaurant workers. In terms of projections of infections in the coming days, I think we are seeing, and we have said that a time will come when our numbers will rise. As we approach the steep incline of our curve, as we approach closer to our peak, and our projections by our experts using different modeling techniques have indicated that we may be approaching our curve sometime in August or September. So far, the rises that we are seeing seem to be consistent with that. And therefore, I think we'll wait and see. But we know that projections sometimes do not bear the truth. That will wait to be seen. But clearly, we are seeing the number of cases increase. The numbers that we have been announcing in terms of those that are positive from the total samples, the rate of positivity seems also to be increasing, an indication of increasing numbers of people who are infected. So we'll continue to see that. NHIF covering the costs of testing. You know, I think it's not only NHIF, the entire insurance industry, I think, is in a situation where they have now to look at and review their policies, because coronavirus was not there before. It was not there when the policies were set and the exclusions and inclusions were set. I think it's a process now of reviewing this and seeing what it means, what the implications are in terms of cost, and what can be covered. But I can tell you that these discussions are ongoing, not only with NHIF, but also in the private insurance industry. I will now hand over to Dr. Amoth.